and then the doc goes, oh, I found out where your pain's coming from. Here it is on these images. Now, that is a huge fallacy right there. So some of the big things that I want to talk about for the low back. So a lot of the times where I think kind of the insurance model has kind of gone off base a little bit in terms of diagnosing and treating low back pain is this huge reliance on imaging. So generally what happens is the flow is that a patient goes to the doctor, they say, Doc, I have low back pain. The doctor goes, okay, they might do a few physical exams just to kind of rule out like the big red flag stuff, like you don't have cancer, it's not an infected disc, stuff like that. They kind of do some mediocre tests because again, in the insurance model, docs don't really have a lot of time to spend with patients. And to be honest, my physical exam and docs in my space, our physical exams are longer than the entire appointment sometimes that people might have in the insurance model. And so anyway, so patient comes in, says, Doc, I have pain. Doc says, okay, let's get imaging. Imaging comes back and that imaging shows degenerative disc disease, or it shows some bulges, or it shows a herniation. And then the doc goes, oh, I found out where your pain's coming from. Here it is on these images. Now, that is a huge fallacy right there. And the reason for that is because there are many people right now walking around with degenerative disc disease, a bulge, and a herniation that are absolutely 100% pain-free. Yes, you can have degenerative disc disease, a bulging disc, or a herniated disc, and you could be 100% pain-free. So one theoretical scenario that I think happens a lot is patients have these findings already on an MRI, and that is supported by research that shows if you take 100 people who do not have low back pain, who are 100% pain-free, if you take an MRI, you're going to find degenerative disc disease or a bulge in 50% of those people, so in 50 patients, okay? So somebody might have these changes already on an MRI. And then something happens where another structure in their back gets injured, whether it's, and the big ones I see are the facet joints, the sacroiliac joint, the superior and middle cluneal nerves. Those are probably the biggest ones. And then they go to the doctor. Then the doctor does a lack of physical exam because it's not thorough at all, gets the imaging and goes, oh, yeah, you have these findings on imaging that we didn't know about before because you never had imaging before. You have these findings on imaging, that must be what's causing your pain. You have severe degenerative disc disease. Let's get you scheduled with a spine surgeon. And from there, then it might become whether it's going to see pain management and you're getting medications, or you're getting steroid epidurals or injections, or you're being referred for surgery based primarily off of image findings and not as much a proper physical exam. And so going back to my example of when I tweaked my back about 9 months ago, if I had tweaked my back there and I would have gone to a doc, and if I wasn't who I am right now in this space, and I had gotten an MRI, it likely would have shown that I have a bulge and or an old herniation and degenerative disc disease because I already know I had that stuff, okay? But if I didn't know I had it and I was just in the general public and I had that imaging done, I get, as a physician on the outside, I get how some people might go, oh yeah, that must be causing my pain because this imaging showed something and I wasn't in pain before, so it must not have been there, okay? So when I tweaked my low back, what actually happened was a superior and a middle cluneal nerve neuralgia. Basically, during a deadlift that I was doing, I irritated and mildly injured the superior and the middle cluneal nerves. Those nerves supply innervation over the buttock and kind of the sacrum area, okay? Kind of in the area where your SI joint is. I'm gonna stand up here, I think you can see, kind of in this area here is where those nerves are gonna give innervation, which is where a lot of people feel their low back pain. And so I ended up giving it a few days, and then I did 2 perineural treatments. Well, my wife did 2 perineural treatments on me, and I was 100% better, and I was back in the gym. And since then, you know, I have been working on establishing better movement patterns so that I'm not at a disadvantaged position to injure them again. But it, you know, I even had, it was funny, there was someone on Instagram who called me out and basically, I won't say he called me a fake, but basically told me that I was incorrect about my diagnosis on myself and that it was a disc issue and that the cluneal nerves rarely ever cause acute pain. And I will fully disagree with that. I see it all the time in my clinic. Patients come in excruciating 8 out of 10, 9 out of 10 pain, but they don't have the classic symptoms of a herniation. They don't have pain that radiates down the leg. They don't have increased pain with a bowel movement, a cough or a sneeze, things like that. And we do a perineural treatment, which is 5% dextrose subcutaneously, and pain goes from, you know, an 8, 9 out of 10 down to like a 2, 3 out of 10 that day, and then that continues to persist. And then after a few treatments over a few week period, they're almost 100% or 100% pain-free. And so yes, the cluneal nerves can cause and do cause acute low back pain, and I think it happens a lot more than a lot of the world even realizes. So that's kind of the framework that I wanted to give. Now,